Let me ask you this. My audience is mostly parents, and the biggest part of it is moms, but is
Mm.
parents who have a son or daughter battling drug or alcohol addiction. And it's usually moms in their somewhere around 40 or mid 30s to 40s up into their 70s. What would you say to parents who have a son or daughter battling drug or alcohol addiction?
I think you need to ask the questions of where a person's at. Like call me qualifier, the person that's using. Are they ready to seek help? Are they still in denial? And you got to see where they're at first, because just because you want to, as a parent, push them in treatment, they may not get well. Setting up boundaries is super important. What's going to be acceptable in my home and what's not? You also need to get your own help. Anybody who has somebody in their house with a substance use disorder, which is better than saying somebody who's addicted, because we need to change the language, and that's how the stigma gets broken, needs to get their own program, like a Naranon, like an Al Anon, because the whole home will heal better if everybody's getting help.
Yeah.
And that's going to lead to longer, uh, long-term sobriety for the person in your house. Because when somebody's using, the whole house gets turned upside down, no
Mm-hmm.
matter what. So, okay, so what do we do now? We need to get tools. We need to say, how am I going to deal with this? Because we don't have the information. People are professionals. But I remember walking into an Al-Anon group 20 something years ago. I was embarrassed. I didn't say, why am I here? And I quickly found out that there were people in my industry there. There were blue collar workers there. There were doctors there. There was a rabbi there because his father was a cocaine addict. I was like, I can't believe, so that got lifted from me, like thinking, who's here? Everybody's here. And then I didn't feel alone anymore.
Mm-hmm.
And I developed tools like, you know, that's just not acceptable in my home. I can't write the bed, take care of that bed check again. There are things you just can't do. And, because I don't believe in that. Oh, they have to fall to their bottom. That's not the way I think.
Right.
But there has to be consequences for actions.
Yeah.
And the consequences generally lead to people getting help.
Mm-hmm.